I think we are on the verge of major discoveries in neurogenetics, and I think it's an adventure.
The Center for Neurogenetics is focused on understanding how genetic makeup impacts neurological disorders and how the environment impacts that genetic information to tip the balance toward health or disease.
We're in a revolution right now in our field where we are making diagnoses nearly daily by using new methods in genetics. Every patient that comes through now, if we suspect a genetic diagnosis, we initiate the workup, and where the clinical stops, the research starts.
Once we can understand what the genetic underpinnings are for these diseases, that will lead us to new treatments.
The importance of this center is to be able to collect clinical data and to be constantly searching through it. To have one location where we can maintain all of that information and keep investigators focused on these families is critically important.
We have now the tools that are the most sophisticated tools available to try to make a diagnosis. It's trying to make it happen in a way that families understand and that is as good a transition and a journey as they can possibly have.
The best part of my job is being able to help these families who have been looking for an answer for either themselves or their children for years. Finally being able to understand why something has happened really is invaluable.
The experience that we gain from seeing patients on a daily basis, from discussing them with our clinical and basic science colleagues, becomes an incubator for new insights, new ideas. When I first trained in neurology, we could make many diagnoses, but we had very little to offer patients once we did that. That's completely changing now.